A potential crisis looming for maternity wards across the country. What moms-to-be should know as President Donald Trump shakes up the medical industry. ABC's Selina Wang has that story.
Looming Medicaid cuts threatening the already dire maternal health system. More than 5 million women in the U.S. live in so-called maternity care deserts, communities with no OBGYNs or delivery wards. The tax and spending plan President Trump signed into law this year slashes Medicaid by $1 trillion over the next decade. Trump says this eliminates wasteful spending, but hospital groups warn the cuts could shutter entire facilities, and maternity care could get hit the hardest. But in Philadelphia, a rare bright spot, a brand new maternity hospital opening its doors at a time when labor and delivery units are vanishing across the country.
Labor and delivery units have shut down in both rural and in urban counties. We here at Temple Health are trying to provide this service to the women of our community close to their home.
Temple Health says their community's infant mortality rate is 3 times worse than the rest of the country, with 13 out of Philadelphia's 19 maternity units closing in recent decades. And Philadelphia is not alone. Across the nation, many women need to drive hours for care, raising the risk of life-threatening complications.
I had a patient who delivered in a campsite. I had a woman who almost delivered in a parking lot. She actually delivered in the elevator on the way up to labor and delivery.
Dr. Herta says that patient was carrying twins. Only one survived with severe disabilities.
If she had been able to get to the hospital faster, do you think both of her twins would have survived?
Yes, I do.